what motivated you, what to create this kit to begin with? Was it something internally in your practice or something talking to people like me, or what was it?
Well, when you mention yourself, as we talked before the call, I was concerned about you leaving your keys in the freezer. But uh, in my practice, I do a lot of work with brain chemistry, and um, you know, it gets tough trying to put together all the things that we need for good brain health. And routinely, I see the same needs over and over again across populations, across age groups. And it just made sense that we have three products that all contribute very significantly to neurologic function and brain function. And it just made sense to put them together to make it easier to say, you know what, since brain chemistry is multifaceted, um, you know, here's a nice, convenient way to hit a lot of those points.
Well, I know for you are the formulator of the super mimics, and from a nutrient perspective, what does the brain really need? Obviously, it must be in these products to help it with alertness, focus, memory, etc. What do we have in this kit that's in specific nutrients that are really going to help folks with that?
Well, let's take things one at a time.
Okay.
Let's take something we spoke about recently, which was coenzyme Q10. Um, I encourage people all the time, if you have any high school age children, grandchildren, ask them, what's the mitochondria of the cell? And they're going to look at you a little bit funny, and then they're going to say, well, it's the powerhouse of the cell. Why did you ask me? And every high school student in America knows that. I mean, trust me, I treat a lot of high school students. Some of them couldn't pour water out of a bucket if the instructions were written on the bottom, but they know that the mitochondria is the powerhouse of the cell. Every high school kid in America knows that, but every physician has forgotten it. And it's very important for us to think about this. We tend to think of coenzyme Q10 as a cardiac supplement, and there's a reason why we do that. Coenzyme Q10 is the enzyme necessary for every cell in the body. Every cell, cells that, brain cells, heart cells, immune cells, cells that regulate hormones, cells that grow fingernails, cells that make saliva. Every cell in your body makes its own energy in the mitochondria. And it has to have an adequate amount of coenzyme Q10. Well, if you don't have that adequate amount, you can imagine what that would do neurologically. But the reason that we think about it as a cardiac supplement is because the hardest working muscle in our body is our heart. So when we maximize cellular energy, where are we going to tangibly see the first manifestation of the improvement of taking coenzyme Q10? Well, it's going to be in cardiac function. But that's only because that's the first thing you see, but it has such a profound impact on neurological function. Just today, I saw somebody who reviewed their labs with me, and we saw that their coenzyme Q10 level was 49% of what it should be. Now, think about the implication there. They roll out of bed every morning. They don't even think about it. They just passively assume that they're going to use 100% of their brain cells. But they're giving those brain cells 49% of the energy they need to do 100% of what they want to do. There's no math on the face of the earth that's going to reconcile that. 51% of what that person's brain cells want to do gets left undone. To make matters worse, coenzyme Q10 does not go up with age, only down. So that lab value that I found in that very young person is never going to get higher. So that means that not only do I need to give them coenzyme Q10 right now to get them to the threshold where they will be functioning at 100%, but they will need to maintain that coenzyme Q10 from now on. Because again, it's not going to go up on its own. It only goes down with age. So that's one good starting point. And I think really speaks for itself. If your brain cells are not functioning at 100%, are you shooting yourself in the foot before the race has even started as far as neurological function and brain function? If you want good brain health, if you want good health in general, you should start by making sure your cells have 100% of the energy they want. I have always argued, whether you see an endocrinologist, a cardiologist, a gastroenterologist, a proctologist, the first thing they should do, regardless of what your physical complaint is to make sure your cells are getting 100% of the energy they need, so your body's doing 100% of what it needs to do or wants to do, and then medicine can take over and start trying to help you from there. But if your body's already not doing all it can do, really that's the very first step, and that's why I mentioned CoQ10 first. So omega fatty acids are necessary for proper neurological function. They're great anti-inflammatory, but just think about that. They're necessary for proper neurological function. The T.H. Chan School of Public Health at Harvard and the Mayo Clinic have advocated for using omegas to treat cognitive issues and mood issues. So, and that's beside all the other things that omegas can help with. But from a neurological standpoint, it's very important to have omegas for proper neurological function. Now, that omega includes a vitamin D, and vitamin D is interesting as well. We always think of it as necessary for proper bone health, and that's true. Vitamin D is called cholecalciferol because it lays down calcium in the bone matrix. So we learn that roughly in middle school. What you may not know is that vitamin D is the only vitamin that's also a hormone that has receptors in the limbic area of the brain that control mood and concentration. Very important for what we're talking about in terms of neurological function and brain performance. Then we come to supermimics, which is as comprehensive as I tried to make it without getting into the weeds, so to speak, on that. It is a composite and a multi-faceted approach to neurological functioning. What it includes are amino acid precursors or building blocks that are there that will convert into the neurotransmitters that our brain needs. Phenylalanine becomes phenethylamine. Phenethylamine is an amphetamine made by our brain, and it just so happens that neurotransmitter is the one that's primarily responsible for concentration. L-tyrosine is the building block that becomes norepinephrine and epinephrine, even dopamine. All of those are very necessary neurotransmitters for cognition. If I were to prescribe Ritalin, or better yet, Adderall, well, we'll stick with Ritalin. If I were to prescribe Ritalin, its mechanism of action is that it forces the release of dopamine, norepinephrine, and epinephrine. So why wouldn't I be interested in encouraging the brain to make its own dopamine, norepinephrine, and epinephrine? And it's a really simple process, because if you use a committed building block, something that you put in the system that you know the next step is it turns into the neurotransmitter that you want. Now, there are times it can be diverted in other directions, but primarily it's going to be converted into the neurotransmitter you want. That's basic high school chemistry. Now, what that means is if you have a chemical equation and you load up the left side of that chemical equation with reactants, things that are going to react, you drive that chemical equation and you force the production of product. So by putting these building blocks in the system, I'm doing nothing but basic chemistry and driving the production of the product that I want, which are these neurotransmitters. And then there's ginkgo biloba for vascular blood flow. Bacopa is in there, which is an Ayurvedic medicine that's been around for hundreds of years and used for ADHD. There are ingredients in there such as teacrine that acts on brain tissue similarly to caffeine without the side effects, and other things to encourage cellular energy, even though CoQ10 is really the cornerstone of cellular energy. And phosphatidylserine, other things that are basic building blocks just for the neurotransmitters themselves. So like I said, there is a lot in that product. And all of those come together to, again, try to cover several aspects of providing for good neurological function and good brain health.
Excellent. One of the things I'd like to do is go back a second to the CoQ10, because I want you to address, if you don't mind, the PQQ that was added to the CoQ10.
Well, and the reason that was done was because PQQ, pyrroloquinolone quinone, is unique in that it increases the density of the mitochondria. Remember what the mitochondria is. I can ask the dumbest high school kid I know, and they're going to say it's the powerhouse of the cell. Well, that PQQ increases the density of that. Well, I want you to think of the mitochondria as a generator. The bigger your generator, the better your power output, right? So if we're doing something to encourage an increase in the size of our generator, are we doing something that's going to encourage the increase in our power output? Absolutely. Now, one of the things about CoQ10, and I get it, it's the nature, when you hear the term energy, we always think in terms of positive energy, but I want you to remember, coenzyme Q10 provides energy for cells that help calm you down, regulate your sleep. It's all cells. So you don't want to be thinking in terms of the kind of energy that's going to have you amped up or, feeling energetic. This is energy that's simply providing your cells the ability to function at 100%.
Well, thank you for making that distinction, because a lot of folks, they think of energy as far as the mitochondria, et cetera. And the point is, and you're made it perfectly, is it's for all cells. And
right. I have so many parents, when I tell them about CoQ10, they said, look, there's my kid up on the ceiling. You really want to give them coenzyme Q10. And I have to go through the spiel and explain to them, yes, because it's not the kind of energy you're thinking about.
I'm going to make a guess, but I'd like you to confirm that have you seen, combining these three products that are now in this kit, major benefits for your patients, and seen a direct correlation between taking these products and benefits?
Oh, absolutely. Absolutely. They fill an absolutely critical need. Thank goodness Body-Wise makes them. I wouldn't want to have to be trying to scare them up somewhere else.
That's true. Now, is there any specific time to take that, or how many? I know the daily dose of Super Memex is 4 a day. Right. Should people split that up? Can they take it all at once for convenience? Do you care, as long as they get it in their mouth?
No, I do care, because it's the thing about super mimics, it is activating. It is activating. Unlike the energy in coenzyme Q10, the energy that you see generated by super mimics is more the positive energy, the energy that we traditionally think of. So you definitely, it's a morning and noon dose. I tell my patients absolutely do not take it after 3 o'clock in the afternoon. Um, and depending, sometimes I have some people who take all 4 in the morning and they do fine, but other people find that it works better for them if they split it up as recommended, and they take 2 in the morning and 2 at noon.
Excellent, excellent. Well,
Let me just summarize from my point tonight. You think about your body health, which includes your brain, but let's just talk about brain for a minute. I mean, there's so many people that I am friendly with that are getting to be in their 70s and 80s, and that brain health is not good. Otherwise known as maybe dementia, Alzheimer's, and so forth. And it's scary because you see what really can happen and how they can lose all these faculties, and in some cases not even recognize their close family. So brain health is so important. The kit is great. Those are great products. It was interesting to hear Dr. Wajda talk about, why these particular products were chosen to be in the kit and the kind of key ingredients that are in there. But brain health, I just think about the whole body, but certainly the brain. I mean, you're starting to hear more and more about, people losing that capability as they get into the 70s and 80s. So I hope everyone will start to refocus on this kit and be using these products, because the alternative, if it happens, is just pretty horrible. Anyway, so that's it for me. Thanks to Dr. Wajda, Karen, Steve, and